Hey everybody, happy Wednesday. I was about to say happy Thursday. I wish, but happy Wednesday. Happy Black History Month. I hope things have been going well for you. We are going to jump right into today's video, which is a kind of follow up to last week's video about broadening your impact as a health professional, as a healthcare provider, and how you can do that through health content marketing. And today, I kind of want to stay in a similar realm and expand upon some of the benefits that can come from having a more broad impact on the public health landscape, the healthcare landscape as a health professional. Even if you practice indirect patient care, some of the possibilities and the increased fulfillment that can come from having sort of a wider footprint in the public health space and being able to use writing, health content marketing in particular, to create that larger footprint. So a quick story that I think will help introduce this conversation. So I, as many of you know, am a pharmacist, but I do not practice as a pharmacist and have not practiced as a pharmacist. I went into pharmacy in order to impact public health. And so that is what my career has been focused on, public health pharmacy, and using writing to like bridge the gap between pharmacy and public health. But being a pharmacist, I do still have the knowledge and the expertise that comes from the training that I do have in the field. So my personal network, i.e. family and friends, often approach me for, different questions and concerns and things like that. Well, my mother, unfortunately, had to have a heart bypass last week, and she was in the hospital for her procedure, naturally. That particular hospital, the COVID precautions that they are still following are such that no one is allowed to be with the person. The patient is not allowed to have a support person at any point in the stay, even once they get to recovery, like they're out of the ICU, they're out of the post-op unit, even in their recovery unit, they're not allowed to have a support person. So naturally, that gave me a lot of anxiety, me and my siblings and whatnot. But I decided that I was going to be in constant not constant communication, but in regular communication with her healthcare team, the surgeon, the nurses who were caring for her, that we would be doing check-ins multiple times a day at shift changes or right after shift changes so that I can make sure to stay on top of what was going on with her from a medical perspective. And so I did that, and her care team was very open to staying in communication with us. So at one point in time, I spoke with her nurses, and every time I would speak with them, I would ask them to run down her medication list, tell me what she's taken, how much, when, etc. And in most cases, they will also tell me what any future medication plans were. So, hey, she's not on this right now, but we might start on this tomorrow, etc. So at one point, after she left ICU and had gone to the recovery floor, the nurse ran down her medications. Mind you, again, she'd had a heart bypass. And we had talked about her being on a beta blocker because that's not something that she was on previously. And that is, standard therapy after a heart bypass. So the nurse ran down her medication list and she did not mention the name of a beta blocker. After some back and forth about why that was, it was determined that that was a mistake on their part. She should have started that beta blocker the day before, and they had not done that. And the only reason that that was realized is because I asked the nurse to run down the medication list. And so that brought me personally a lot of anxiety. And as a daughter who already had anxiety around my mother being in the hospital without anyone there with her, that was a very uncomfortable feeling. But I also looked at that from the perspective of a healthcare provider, and not just from the perspective of like, if I were a pharmacist at that hospital, but also like from the perspective of that nurse, from the perspective of the surgeon. And really, it just kind of shone a light on a lot of the issues that you can face no matter what your role is in the healthcare ecosystem. So you're always, you always run the risk of causing a medication error or causing some other type of medical error. You always have to deal with the politics of the hospital. You also always have to deal with policies of the hospital. You are often dealing with a lot of barriers in your professional career that are not necessarily related to the patients, right? And that can cause a lot of frustration when you are working in a direct patient care environment. If you think about, people who don't necessarily work in a hospital environment, but like in clinics or private practices or private pharmacies, you have the corporatization of healthcare, and you have dealing with insurance companies and PBMs and third-party payers. You have the very metrics-driven style of healthcare that a lot of healthcare providers are subject to. And I'm sure there are plenty of other examples that you could think of in direct patient care roles that affect your ability to do your job well, like do the healthcare aspect of your job well, but then also that affect how you perceive your work as a healthcare professional and how fulfilled you are by the provision of direct patient care, just because there are so many other things going on that could possibly take away from your fulfillment in that experience. And so in conversations with colleagues and friends who are in direct patient care roles, I feel like the three feelings that come up most often are frustration at not being able to make a complete make the full impact that you feel like you have the potential to make in your role. For example, pharmacists who work at chains, a lot of my friends in those positions feel like they don't have enough, they don't have the space to be able to really impact their patients in the way that they want to. So that leads to frustration with the metrics-driven nature of a lot of healthcare roles. My friends and colleagues, and possibly you, are in situations where you're feeling overworked and then also undervalued, right? Because you still have people pushing you to exceed, meet and exceed these metrics, and to stretch yourselves even thinner than you're already stretching yourselves. And so even having those wonderful transformative experiences with the patients that you work with is kind of weighed down by those feelings of frustration and overworking and being undervalued. And so that's then when my friends in healthcare then come to me, because they are feeling these negative emotions associated with their roles. And that leads them to then looking for, like, hey, what can I do as a creative outlet? What can I do? This is not a role that I necessarily want to leave right now or feel like I have the capacity to be able to leave right now. But isn't there some way, something that I can bring into my life that will give me like a mental health outlet, a creative outlet, and still allow me to impact patients in a way that feels more meaningful, in a way that feels more impactful than I may currently feel in my current direct patient care role. So in my experience, not having been in direct patient care, my response to that is always, what are the things that you have in your wheelhouse already as a healthcare provider, as a health professional? You have a background in not only the academic training to be whatever kind of healthcare provider you are, whether it's a pharmacist or a nurse or a physician or PA, you have that academic background. You also have the experiential background because you've practiced in this area. So what are ways that you can use that knowledge that you already have and still find fulfillment within the healthcare space or the public health realm, in addition to your role as a healthcare provider? And so it comes down to really like three things, like how can you really use your degree, but also add some creativity into that and have that be like a creative outlet for you in a way that feels impactful? How can you impact healthcare in a broader way so you don't necessarily feel like the extent of your impact is tied to what you can do for a specific patient, but how can you expand that as well and bring more fulfillment into your life personally? And then how can you also create additional streams of income so you don't feel like you are financially tied down to a specific job? Because that's a real concern also, right? We get a job, we build a career around a specific role, around one specific role, and then our lives end up being tied to that specific role because that's our only source of income. And so adding that perspective into the conversation kind of helps you be a little bit more flexible, because you aren't necessarily tied down in one specific area that may or may not be healthy for you. So I feel fortunate that I was able to pretty early on identify writing and specifically health communications and health content marketing as my way to have all three of those things rolled into one. My use of my degree along with a creative lens, being able to impact healthcare broadly, which was always my intention, even going into pharmacy, and then using that as my primary source of income. And I also accidentally stumbled into this space when I was in a role where I did not feel completely fulfilled personally. Was it a great professional experience? Absolutely. Did I learn a lot? Yes. Would I have traded it? No, I would not have. But I also have to acknowledge that in that role a few years ago, I was not necessarily personally fulfilled, and that affected my quality of life. And so by finding health content marketing and exploring that space further, I was able to get those extra benefits from having that broader impact, and that improved my quality of life while I was in that role, as opposed to just being in that role and kind of being miserable about it. So that is just kind of some context to think about. Like if you find yourself as a health professional in a position where you are feeling those frustrations that come along with the politics and the money and the metrics associated with a lot of direct patient care roles, where you are feeling overworked or undervalued, or like you're not having the extent of the impact you want to have, I think it can be helpful to start thinking outside of the box. And rather than feeling like you're stuck in this one position that you can't get out of, think of things that you can bring in to that situation that can help kind of take away from the edge that you might feel around that particular role. So I know that we just briefly touched on health content marketing in this particular video. If you recall the mini series that I did a couple of weeks ago, there were about 3 videos where I went into more detail about what health content marketing really is. But I also have some other resources that kind of go into more that I would like to share with you. Kind of writing health content marketing actually is, and that can be a new concept for a lot of people, and some live examples of what health content marketing actually looks like. So if that's something that you would like to see, or that you're interested in kind of, that you are interested in getting more insight into, like seeing what those actual examples look like, just shoot me a message, and I can email them to you. Shoot me a message with your email address and I can send you the resources. Jane, I saw that you asked, how do you transition into medical writing with no experience? So that's a great question. And I think that it largely depends, one, on what type of medical writing you are trying to transition into. So if you've listened to any of the previous videos, you've probably heard examples of the different types of medical writing there are. And your approach to getting into that no experience might be a little different depending on what type of medical writing you're trying to get into. One of the reasons that I focus on health content marketing for health professionals is that the barrier to entry is a little bit lower. Not because the writing is less important or less valuable, but because the technicalities of it are a little different, and I feel like are a bit more accessible than maybe some of the different types of medical writing that exist. But in general, I can say in general that if you're trying to transition into medical writing without experience, that your primary, one of your primary goals is going to need to be figuring out how to get that experience. And that can be through freelancing, that can be through volunteering, that can even be through, creating your own maybe article or post or piece of content that answers a question. So it doesn't necessarily have to be that you were hired to do this particular thing. Uh-oh, I'm freezing. Am I still frozen, Jane? Hi, Simi. I see your question. Let me make sure I'm not still frozen before I answer you. Am I good? I'm going to keep talking, but if you all tell me that I'm frozen, then I will switch my Wi-Fi. So yeah, working on ways to get those samples on your own so that you can have proof that you can write, because that's what people are going to want to see. They'll want to see that proof. Simi, you asked, can I expand more on... Jane, I hope that means know that I'm not freezing, not know that I'm not good. Okay, thank you, Tunisia. So Simi, you asked, could I expand more on what medical writing entails? So that is medical writing is a broad umbrella term. It can refer to a lot of different types of medical writing. And Simi, after I conclude the video, I'll come in and I'll send you a link to another set of videos where I talked about the different types of medical writing. But just to kind of level set everyone right now, medical writing is an expansive umbrella term that includes lots of different types of writing. The types of medical writing that I have focused on in the most recent years are health communications, which is a type of writing, and other communications like graphics-based communications, infographics, fact sheets, video scripts, things like that, but that are usually geared towards the general public, people without a background in healthcare. And within that, I found a niche of health content marketing, which is basically using that health communications lens, but also combining it with the principles of content marketing, which companies use as a way to spread awareness of their brand with their target audiences. And the way that you do that through content marketing is by creating content like articles, posts, videos that answer important questions. So if you have a person who has a headache and they want to know what to take for their headache, they can type into Google, should I take ibuprofen or acetaminophen? And the companies whose articles show up in Google as results for that, as answers to that particular question, those are examples of like pieces of content marketing. And Jane, you said you need those videos too. Yeah, I'll put them in the comments so that you can get them. But that's an example of, or that is like a definition of what health communications and health content marketing entail. Like I said, there are lots of different other types of medical writing, but those are the two that I focus in most. And again, I do have some examples of actual content marketing pieces that I can show you, and a little bit more background on like exactly what health content marketing is. So if that's something you want, just shoot me a message. You can leave a comment, but sending me a message is the most guaranteed way to make sure that I know that you want the resource. So just shoot me a message with your email address and I can send that over to you all. So Christine asks, what would you recommend for a student graduating soon trying to get into this field? That's a great question, Christine. So pharmacy student, okay. And even if you are not a pharmacy student, if you are any type of health profession student, this same thing applies. So in case anyone is listening on the replay and they're like, oh, what about medical students or veterinary students or nursing students? Same thing, whether you are a student or whether you are already a practicing professional, the same kind of pathway applies. I think that the number one focus needs to be on learning more about the field. So understanding what content marketing is, why it's important, why an organization would need it, and then learning the technicalities of that, right? Like, so how do I actually do it? And then you have to practice doing it. So when I go to write for, like, for example, I write for GoodRx. I say, hey, I would love to write content for GoodRx. Do you have any availability, or would you like to talk to me further about what I can do? The first question they're going to say is, do you have samples? Do you have a portfolio? Do you have something that I can look at? And if you don't have that, it's going to be really hard to make a case for why you should be able to write for that particular company. So whether you are a student or whether you are already a practicing professional, you're going to have to learn about what content marketing is and what that style of writing entails. And then you have to get practice in doing that style of writing and use that as your body of work to show that this is an area that you are skilled in. And that takes some time, but that's also why I'm here and why I'm sharing these things with you, is because I realize that there are a lot of health professionals who are interested in this, and not only health professionals who are interested, but I personally think there need to be more health professionals who are using health content marketing skills to fight health misinformation online. And so I want to be able to say, hey, to say to a client that I'm working with, hey, I might not have the bandwidth to do this project right now, but here is X person who I know is a pharmacist or a nurse or a physician, and they are excellent at writing and they can write on this topic. I think there need to be more health professionals who are in this space. And so that's why I'm sharing this information, to help people learn more about the area and more about how to get into the space. But again, to recap that answer to the question, it takes learning about content marketing, how to do it, and then actually doing it and having the practice. So I will make sure to, whoever sends me the email saying that we would like more of the resources about content marketing and examples of content marketing, I'll make sure to send that over to you all. And if you continue to have questions, that's fine. Leave them in the comments and I'll be able to come in and respond later, even when the video is ending. But I definitely appreciate you all showing up. And these videos are happening regularly on Wednesdays at 5:45. So if you just want to, tune in and schedule your calendar to tune in at Wednesdays on 5:45, feel free to do that. They'll also be available afterwards. So if you can't catch it one week, it'll live on my LinkedIn profile. It'll also live on the Health Content Marketing with Megan YouTube channel. And just, hop in the comments, send me messages, let me know what your questions are, and I'm happy to answer them as best as I can. So I hope you all enjoy the rest of your night, and thank you so much for all the questions and comments. Don't forget to shoot me a message if you would like a message with your email address if you would like the resources and examples. Okay, I will talk to you guys soon. Have a good one.